draw the arteries of the thorax, we start again by drawing the heart, pointing a little bit to the left. We're always beginning with the left ventricle. And start off by drawing that big arch that is the aorta. The aorta has its three main branches, ending with that left subclavian artery, which we're going to draw nice and long. You can remember those branches of the aorta by remembering your ABCs: A for ascending aorta, B for brachiocephalic trunk, C for common carotid artery, and S for subclavian artery. ABCs. Remember that your aorta has those three separate parts. Coming off the aorta, we're going to first draw a little fork branch, just a couple pairs of branches, and one more little fork. These are the branches as they come off the descending aorta before we cross down past the ribs. Past that rib number 12, we're going to draw in one more branch. Coming down our descending aorta, that first set of branches are the bronchial arteries sitting on the main bronchi. Next, we have posterior intercostal arteries. There are multiples of these on both the left and right side, running into spaces 3 to 11. Along the descending aorta, we're going to have multiple esophageal branches, which are all along wherever the esophagus is, so we are just acknowledging they exist here. Running underneath rib 12, we have one last artery, and that is called the subcostal artery. Moving on to branches of the subclavian artery, we're going to draw one going up, a long artery coming down, a small artery coming up, branching into 3, another small one coming up, branching into 2, and then the subclavian artery ends when it crosses rib number 1. The first branch of subclavian is the vertebral artery. That second branch is called the internal thoracic artery. And the third branch is the thyrocervical trunk. And our last branch is called the costocervical trunk. You can remember these 4 arteries by remembering to take your vitamin C, VITC. These 2 trunks have multiple branches that apply more to the head and neck or to the limbs, except for this one branch of the costocervical trunk known as the supreme intercostal artery, also known as the superior intercostal artery, which supplies the first and second intercostal spaces. For the internal thoracic artery, we're going to draw one big branch, a couple little branches, and then one final branch where the internal thoracic artery ends. This is just below rib 6, and we've got a couple extra branching points. So down the internal thoracic artery, that first branch is called the pericardiocophrenetic artery. Our next branches from intercostal spaces 1 to 6 are the anterior intercostal arteries. And then we're going to split below rib 6. The lateral branch is musculophrenic artery. The one continuing down is the superior epigastric artery. And those branches of musculophrenic, these are also anterior intercostal arteries. So we have some on the internal thoracic artery and some on the musculophrenic artery. Please note that for both the posterior intercostal and the anterior intercostal arteries, I have not drawn in every single artery, just sort of a general idea of where they are. The subclavian artery churns into the axillary artery once we pass rib number 1. That axillary artery mostly supplies the upper limb, but it has a couple branches that are going to also supply the thorax. So we draw 3 small branches here. That first branch is going to be the superior thoracic artery. That second branch is the thoracoacromial artery. And our final branch is going to be the lateral thoracic artery. And then we're done.